feeling like sunshine, like springtime, like something's in the water and I'm taking a deep dive. I'm feeling so weightless, like I'm gonna make it, and nothing in the universe can take this. I can see it clearly now, nothing gonna bring me down. I got my head held high, I'm on my way, and I'm following the signs to my happy place. I'm walking in the light of a brand new day, and I'm right where I belong in my happy place. I got my head held high, I'm on my way, and I'm following the signs to my happy place. I'm walking in the light of a brand new day, and I'm right where I belong in my happy place. And I'm right where I belong in my happy place. And I'm right where I belong in my happy place.
Hello and welcome to the National University of Singapore Yonglou Lin School of Medicine's Healthy Longevity webinar. It was supposed to be Andrea hosting tonight, but she had another event come up, and so you're stuck with me. Hopefully that'll go well, except my voice is going out rapidly, so we'll see how it goes. I'm also here in Ireland at the LSD conference, and so it's very exciting. And don't get any ideas. LSD stands for Longevity Summit Dublin. This is one of the exciting aging research meetings every year, and so there's a lot of interesting findings being presented. Tonight we have Thiago Osóriom, who will be presenting to us about the secrets of Healthspan, and so we're very excited to have him. Please use the Q&A functions. There are no such thing as bad questions. Before we get to him, though, we're going to have Thiago Guimarães, a senior research fellow at NUS, who will be talking about his own study, reference data for hand grip strength, analysis of individual participant data from 27 countries.
Thank you very much for the introduction. As mentioned, my name is Thiago Guimarães, and I'm a senior research fellow at the Academy for Healthy Longevity. Today I'll talk about our recent study which aimed to establish reference data for hand grip strength among 27 European countries. So just to briefly highlight what are reference data. So they are used to compare the results of a specific test from an individual to the matched population for age and sex. So we aim to establish reference data for hand grip strength. And as you can see here on the photo, this test involves squeezing a hand grip dynamometer as hard as possible to get maximal strength values. And this is a really important biomarker of overall health, given that hand grip strength is associated with all-cause mortality, cardiovascular mortality, disability, and many other health outcomes. So for this study, we use data from the SHARE cohort, which is a survey that started in 2004 as the first wave and includes adults 50 years and above. For this study, we use data from the 9th wave of the survey, which is the latest wave in which hand grip strength data was collected. So this was conducted back in 2021 and 2022. Hand grip strength data are available among 27 European countries, and the total sample size of participants for this study was 58,000. So we established region-specific reference data because we were thinking that there might be a region variation in hand grip strength. And if we look at the two upper sections on this slide, we can indeed see that individuals from Northern Europe tend to be stronger than those in southern regions, western and eastern regions of Europe. But we also know that height varies according to these regions, and individuals from Northern Europe tend to be taller than other regions of Europe. So we also did additional analyses to see if we express these values in relative terms. So if we divide hand grip strength by height, to see if these differences in regions still persist. And even if we do a relative analysis, we can still see that individuals from Northern Europe are stronger than those in other regions. So going back to the pooled analysis among all of these 27 countries, so we calculated reference values according to these different age groups, so starting with the ages of 50 to 54 all the way up to 90. And we can see a sharp decline in hand grip strength across all of the percentiles. And these values are really important given that they can be used for health screening. So practitioners can use these values to see if a given individual might be at a higher risk of developing functional decline or muscle health related diseases such as sarcopenia. These values can also be used at the population level to see if there are changes in hand grip strength over time. And we can also use these data at the individual level to prescribe specific interventions such as exercise and nutritional supplements to those who might have lower hand grip strength. Thank you very much for your time, and if you're interested in finding more about this study, feel free to reach out on the email provided here. Thank you.
Thanks. It's great to see the amount of data that's coming in on some of these measures of strength and that are related to aging. I think that'll be very helpful as we think more about interventions. Today, our guest host is Thiago Osório. He's a Brazilian-trained medical doctor with nearly 2 decades of experience in cardiology, electrophysiology, and lifestyle medicine. His background includes published research in cardiovascular science at UZ Brussels in Belgium and clinical work with elite athletes in Sao Paulo. He recently joined the Institute for Healthy Longevity in Abu Dhabi, where he advocates for evidence-based lifestyle interventions to prevent and treat chronic diseases. The title of his talk today is The Best Magic Pill for Healthspan. Thanks for joining us. I'm interested to hear the magic.
Hello. First of all, thank you for the opportunity to be talking here. It's really a pleasure to be here. And yeah, let's try to discover this. What is this magic pill that we can take for longevity?
Sounds good.
Lifespan. So, what's the best magic pill for Healthspan? And before talking about Healthspan, it's interesting to try to understand what's the definition of Healthspan if we have one. So a common definition is that Healthspan is the period of life spent in good health, free from chronic disease and disability. Although we can argue that if you have, for example, hypertension, you take some medicines and you're feeling okay, you also can have a very good health span. For some people, if they cannot run a marathon anymore, maybe they don't have a very good health span. So it all depends on what you're thinking about this health span. But in theory, it's yes, you want to have a very good quality of life. And why it's important to talk about this, because as we can see in these two papers, the gap between health span and lifespan is just increasing. And that's why a good thing also, because we're becoming very good in treating disease. That's great. Huh? I love that was a lot of what I used to do. But we cannot forget that we need to shorten this gap. Otherwise, it's going to be a huge problem. And at the end, if you're living 10 years, and especially your last 10 years of your life in a bad quality, I think nobody wishes that. So this magic pill can give you energy, strength, metabolic health, inflammation control, free movement, immunity, eye-hand coordination. You can pick. And a question for everyone, and would you take this pill if it could prevent the majority of the chronic disease? The more regular you take it, the greater is the benefit. You reduce, you're going to be aging in a better way. Your disability is going to be lower. We have a lot of human data. You can see cardiovascular disease, metabolic, muscle, brain health, all this. And actually, if you don't take this pill, you have normally a very high risk. Would you be willing to take this pill even if it's hard to swallow? So even if it's difficult? And I think the majority of people say yes. And now we're going to have an idea a little more what is this pill. And actually we know this pill like 5,000 years ago already. So 5,000 years ago, they used to give this pill for survival and for warfare. 5,000 years ago, they used to prioritize this pill for soldiers. And if you go a little to a more modern life, only 2,500 years ago, we have had like Plato saying the lack of this pill, it destroys the good condition of every human being, while movement, methodical, physical exercise save and preserve it. So now we have a little more idea what is this pill. And I like to talk when we think about longevity, when we think about our human beings, we like to, nothing in biology makes sense except in the light of evolution. So we need to think about evolution. And not long ago, we were still hunter-gathering, but we still have a population in Africa, the Hadza tribe. And here you can see the graphic between walking distance and age. And as you can see, comparing to Westerns, they walk much more every single day. And if we change this, so this is moderate to vigorous physical activity. So here you can see the famous 150 minutes, but here we talk about day. So what you can see is even when they're 70, they're moving 150 minutes a day. It's not a week, a day. When they're younger, 300 minutes. So that's important to understand in terms of evolution. Again, we were built to be moving. We were built to move, to walk, to try to do several things. And there, even when you get older, their retirement is also keep moving. So they pass more time outside searching for food when they're older. So if we evolve like that, but unfortunately today we have this paradox. So that's in European data. Less than 1/3 of the European citizens declare spending at least 150 minutes per week moving. 46% of the Europeans never exercise or play sport. 46%. And actually have only here 7% that they do regular physical activity. 5.5 hours that people are spending sitting or more. And unfortunately here we see actually young adolescents and adults, 51% they spend more than 5.5 hours. So again, we want to talk about lifespan, health span. We need to follow more what we're evolution. So now we're just sitting. And that's the price for this. So in these two papers here, we have 5.7 million participants. And unfortunately, the prevalence of insufficient physical activity was 31%, and it's increasing. And if you focus in a younger age, here's 11 until 17, globally in 2016, 81% was insufficient in physical activity. So again, we are doing the opposite of evolution. And this has a lot of cost, but also economically. In 2013, 53.8 billion was spent in terms of healthcare, plus almost 14 billion in terms of productivity loss. So lack of physical activity is the fourth leading risk factor of global mortality. If you want to focus in, again, longevity, we need to be moving more. And between 2020 and 30, we predict we're going to spend $300 billion on this. So imagine if you just take a fraction of this, and we could use this to give for grants to study aging, for example. Okay, and now we have World Health Organization, and this is moving, and I put a circle here because sometimes you hear that too much exercise is bad for you. And I understand, but too much exercise, maybe 0.1% of the population is doing too much exercise. So if you can go for 300 minutes per week, go for it. Don't be afraid. Here they already put muscle strength, go for it. Do a lot of different activities, and especially let's try to avoid, there's nothing wrong to enjoy a cozy time, a moment. Let's try to avoid to be seated for too long. Again, it's just nice to see big organizations like American Heart Association saying muscle, move more, sit less, feel better. So just a few studies that I took. I'm not going to, we could talk about a lot of studies here, but this was a brilliant study. Everybody that is here, and we have this idea that, and we know that VO2 is extremely important for longevity, or we can correlate VO2 with, let's say, lifespan, but also health span. So here it's a study that they analyzed VO2 for 4,000 participants, and they followed them for 24 years. So they got the first analysis, VO2, and then they followed them. It was low fit, moderate fit, and high fit. And not surprisingly, they found an inverse relationship between cardiorespiratory fitness, or VO2, and mortality. But those numbers just unbelievable. So men that were in the low fit had 54, 49, and 46% greater likelihood of dying from all-cause cardiovascular disease and cancer than high fit men. And was very similar to women. So we're talking about 54%. That's huge. Is regular physical activity good for us? Like we know in this group, like after adjusting for traditional risk factors, the low fit group was associated with 73% increased risk of all-cause mortality. Again, that's a huge number. Similar study, VO2. But here I just put this graphic, which is important to see. You see, if you are an elite, and that doesn't mean that you're an elite athlete, but if you have a very high VO2, yeah, your survival is higher. But the biggest gap is when you go from low to below average. So if you can do this jump here, if you start moving, if you start practicing this exercise, you're already going to improve a lot. Different study, I again just putting big journals publishing this. 6 months high intense interval training was 4x4, so 4 minutes in a 85% to 95% of heart rate, 3 minutes rest. They did it for 6 months. That's it. And we got 1.2% of reduction in the atheroma, so in the size of the obstruction that they had. 1.2%, say, Thiago, but 1.2% is nothing. Actually, if we reduce 1%, it's associated with 20% reduction in the odds of major adverse cardiovascular events. And if you compare with big studies like Saturn, that if you're taking atorvastatin or rosuvastatin, it's almost the same effect. And I say that you should not take any medicine, of course not, but you can add exercise and also have very good results. So again, we know. Now, lack of muscle or sarcopenia, is that a problem? We have, again, plenty of studies. I'm not going to enter in details here. It's just if you have curiosity to enter and check them. I just took this study here to show one thing. So they did a biopsy, and you can see young and old. So here you have fast fibers, slow fibers. You see slow fibers, they're almost all the same if you're young or old, but you lose a lot of fast twitch fibers. So this data suggests that age-related loss in power is because you're losing fast fibers. That's important because then you need to do something specific for that. And this other paper is kind of pointing to this. So identical twins, 30 years of difference in terms of what they do. So one very good Ironman marathon, the other one normal sedentary person. And if I ask for everybody who's watching here to really try to fill this table, maybe you're going to put some things wrong here. Of course, people who are trained, they have better VO2, they have a better body fat percentage, they have better blood pressure. But actually, the lean body mass was the same. Remember, they're identical twins. Lean body mass was the same, even with 30 years of very different activity. But muscle quality actually was better in the person who was not doing exercise. The strength was also better in the untrained person. That means we should not do endurance exercise? Of course not. But when you do only one kind of activity, as you can see in the biopsy of the muscle, the fiber type 1 becomes extremely prominent. So you have much more of the endurance fiber, but you don't have almost anything from the fast fiber. And we saw that if you're getting old, you lose already fast fiber. So if you're only doing cardio, it's not the best solution. So about resistance training, so heavy weights, I think was the resistance training for a long time neglected. We think about bodybuilding, we think about those big guys, which is, there's nothing wrong, but a lot of people don't do it. But actually resistance training, you can click all the box for Healthspan. So if you want a better mood, you have. If you want a better brain, you have. Reducing risk of fall, you have. Glycemic control, lipid profile, everything you have. And here, just to have an idea, this is a young muscle, young leg, sorry, and that's an old. You see, from if you're doing exercise, you're very similar, but if you're not doing anything, you see that the quality of your muscle is not ideal, I would say. Again, we have plenty of studies. You we can enter to click on them. They're very interesting to see. Osteoporosis, we know that's a huge problem. What they did, very nice study, they live more. They took, old ladies and they put them to do deadlifts, overhead press, and back squat. Exercise that if you talk with a lot of people, they're afraid, or the doctors, they say, no, you cannot do those things. And actually, you can do those things. And they show that after 8 months only, actually they improve bone mineral density for 2.9% in the lumbar spine, compared to the control group that they lost 1.2. And actually they even got taller, 0.2% against minus 0.2. We have studies talking about exercise, just a small amount. Here was literally a minimal dose of 3.4 to 3.6 minutes, associated with 17 to 18% reduction of total incidence of cancer. We have a lot of those studies, but unfortunately, we're still trying to convince our patients like that. So what fits your busy schedule better? Exercise 1 hour a day or being dead 24 hours a day? We're not going to convince people to do exercise like that. So only a few doctors really ask about exercise. We're lacking of time, we know that, desire, but also knowledge and especially compassion. We really don't try to think about breaking a habit is super difficult. Otherwise, people would be fit. And for my lucky 1 month ago, we have this in the New England Journal of Medicine, maybe the best journals in the world. Why I'm showing this? So it was about structured exercise after chemotherapy for colon cancer. There were 2 groups. One received education about nutrition, about exercise, and actually they did very well, if you see in the chart here. But the other one, they have in-person lessons and was exercise, but important here was impersonal behavior support. You need to help people with their behavior. And the results, that's why you publish, exercise reduce the relative risk of disease recurrence, new primary cancer, or death by 28%. Exercise reduced the relative risk of death by 37%. And they even conclude that it's similar to that many current approved standard drugs. Of course, it's not the substitute, but you can add. But we know all those things. We really know. I think the majority of people who's listening to this, we know that exercise is good. But that's a question for all of us. Like, are you engaging in what we recommend about exercise? Are you doing it? And if you look to your family, your friends, are they doing this? Are they practicing exercise? A lot of times it's no the answer. But we know it's that good. So what is going on? There's a lot of barriers. I don't hike. I don't have time. I'm not motivated. You can name it. I'm not a gym person. It's going to hurt. I'm afraid. But there's also mental barrier that we forget. People sometimes, they don't have self-care. They don't think they deserve the time to do exercise. So I'm talking this because we're talking about living longer with better health, but we need to think about how to communicate better. And sometimes that's why that opportunity that we're having here is great. And what you guys are doing is amazing. The initial video that you see people moving, because we need to communicate this better. So people are afraid. People, they're fear of just anxiety, the judgment. Like if you enter in the gym and you don't know anything, you're just lost. So help your clients, patients to understand the why. And to understand your client and provide literally something specific for them, you need to ask a lot of questions. And one question that we don't ask is exercise vital signs. So we check heart rate, blood pressure, weight, a lot of things. But we don't ask about exercise. And if you ask, are you doing exercise? Yes, no, okay. Ask for exercise, ask the frequency, ask the intensity, ask the type, the duration, how they feel. Try to communicate with them better that they will, okay, they're valuing what I'm doing. You write a prescription for drugs, which is absolutely okay. I do this every day, but write a prescription for exercise. There are a few protocols, this one protocol, frequency, intensity, time, and type. You can read this with more time, but write a specific protocol. Intensity, you can go as granular as you can. You can take percentage of VO2, or you can just do talk test. You can say to your patient, if you're talking, but you cannot sing, or you cannot even talk anymore, but you need to communicate, you need to explain this to them. Set a goal with them. We set a goal for a lot of things we want in life. Why not set a goal for an exercise? Why not set a goal for I want to have a very good health span? And here's an example. Break down this goal, ask for them to do it. What, where, when, how long? Evaluate what's really your goal, and again, and again, and again. Create a couple of if this happened, then I'm going to do this. If the weather is bad, I used to live in Belgium, the weather is bad a lot. I can't walk in the park after her gym. So just go for it, go do a brisk walk inside, create these ideas. And then we have all these kinds of modalities. Today we have a lot of things. All these names. But what should we really do? And I try to put in this slide just a fast rule. So this lifespan principles is thinking long term, not in a week, but try to think in years, in decades. Don't have major weakness. Don't be super in one spot, except if it's your goal in life, but otherwise try to be balanced in a way. Consistency is the key for a lot of things in life, and for exercise also. Don't avoid take breaks. Don't be sedentary for years or decades. Focus, yes, balance training, mobility, range of motion, strength, power, endurance. It appears to be a lot. But if you plan, if you understand your why, if you have people to help, if we can help patients, that's amazing. You can choose your method. If you want to do alone, like I like to do it alone, go to the gym. If you want to do with people, go. If you want to use body weight, bands, weight, machine, you can aim it, you can do it. We have the resource. But we need to understand that if you want to have a good health span, being active, having good muscle, a good heart is extremely important for us. We can take the best drugs, and I think it's amazing that we are evolving in this area, but we also need to help our evolution. So here is just a small example from a client that I really appreciate, and I asked her a week ago. So 120 kilos, 12 November, here you can see the graphic, was lifestyle intervention. So here, again, I'm not against any kind of medication, but this was literally lifestyle intervention. It was about food, it was about exercise, was about stress, understanding. So you see the evolution. And one of the things that triggered her was to be able to do this activity. So flight more. Before she was not able to do it. There was a limitation in terms of weight. Now she's literally flying. And my last thing for a health span is this lady here. So how old is this lady? Let's see if I can put the video on. Yeah. So how old do you think is this lady here? And actually it's a extremely nice example that I have in life. So this lady is 81 years old. So she's flying, she's doing her best. And if you think she had a lot of back problem, now she does not feel. So health span is something we can achieve, but we need to plan. We need to want to achieve with a goal. It's not only I desire, we need to really calculate. So thank you for open minds and your commitment to health. Stay active, curious. Let's continue to push boundaries. Thank you very much.
Thank you. It's a great talk. I think it's a great message. I think a lot about exercise and lifestyle, both for myself and how to help other people do that. I think there's a lot of good signs, good comments in there. Maybe I wanted to start with, you mentioned this already, that health span is kind of in the eye of the beholder. I think we tend to define it as disease-free and active and functional, but there are a lot of people that come back and push back on that and say, I've got diabetes, or I've got, cardiovascular risk factors or something like that, but I still feel like I'm healthy. So, I think that a lot of these people may they could certainly improve sometimes, but they still feel like they're pretty healthy. So what do you tell people to try to get them to, to get them the idea that it's a gradient, it's not a yes or no answer?
Yeah, that's why I think when we tend to be binary, yes or no, one or two, it's difficult. And they say, okay, if the definition of health span, I cannot have one disease and I don't have health span. That's not true. For some people that I know, if they cannot literally cycle for kilometers a day, they are very unhappy. We can talk about, but they are very unhappy. So it's really what means to you. But this, I think we sometimes forget about, to really understand what we want in life, and that's a problem. If you don't know where you want to arrive, it's difficult. So if you say I want to hike when I'm 75 years old, but today you're 40 and your VO2 is 28, it's going to be challenging.
Yeah, I agree, and I think one of the problems with exercise is that I think people get in the habit of not being fit, and they, don't remember what it's like or realize what it's like to change that fitness. And there's like an activation barrier to exercise. I always did some exercise, but I started running when I was 40. And for the first, couple months, it was hard. I didn't like it. I was out of breath. It was a challenge. And then it's like getting over thresholds running. You get over that first threshold, and then maybe you can run up to 4 or 5K and you're not miserable. And now I can, I can run maybe 20K without too much stress now. And so I think that one of the things that I try to tell people is the amount of confidence you gain from achieving those goals. It impacts your whole life, not just your physical fitness. I think a lot of people, especially people that weren't athletes when they were younger, they feel like this is an alien, atmosphere to go into the gym or putting the running shoes on, but they don't have to be Usain Bolt. Once they start making clear stepwise progress that they can recognize, I think it's really self-empowering.
Yeah, I think you point a lot of important things. I think if you check the data, exactly, if you go for the low level fits to already above level, you're going to improve a lot your chance of survival, of having a very good life. And it's important to pass this message that it's hard. Normally, everything that is painful, hard immediately is going to give you good long term. And a lot of things that give pleasure, normally they're not very good for long term. And normally you have this, so you feel pain to run bad, but you start getting used, then you start liking, then you start loving, then you hurt yourself and you're pissed off because you cannot run.
Yeah.
And we see this
I agree
again.
with that. I think it helps your mental health too. I mean, there are studies on this, right? There's a Stanford Runners study. The shocking thing to me was the people that were running 2 or 3 times a week had lower Alzheimer's, and so there's prevention from cognitive diseases. But I also think that there's kind of I can't do meditation. It's just not me. I can see the value of it, but I can't do it. But, I get my meditation on long runs that, it really affects my mental state. It's a place where I can calm my brain down, and I think that
Absolutely.
those two things are highly related to each other.
But if you go back to evolution, we are still animals, huh? We are from millions of years of evolution, but we are animals. We are never built to be. The transition is just too fast in the last 100 years, maybe, but we are the same. So if you just sit talking to a screen, let's say I'm not even seeing interaction with you. So I think the pillars are from lifestyle medicine, which it's very similar. It's going to give you power to live better, mental health, and what we want. We want to have health span, and not only lifespan. Otherwise, it can become really a problem, actually.
How do you recommend? I mean, you're trying to help people get to a higher level of exercise and, better wellness. How do you combine that? How do you do that? And how do you combine it with recommendations on diet?
So I think it's a lot of having a team, or if you do individually, that's super key. But then you need to have a different kind of client that you invest much more time. Huh? So again, I try to show them what's your goal. And sometimes as this to people with 40, 50, 60, they have no idea. But then you need time to reflect. What's your goal? You have that goal. So it's easy to backcast and understand, okay, I have this goal. I need to have this, and this function. Again, if people want to have a lot of money when they're 65 and stop working, they start saving. But we don't do this for exercise. We do this for mental health. So this is important thing. But if you want losing weight, I don't know if that was also the question, but it's nutrition. It needs to be calories. At the end of the day, it's going to, if you eat 4,000 calories of broccoli and your rest metabolic rate is 2,000, you're going to gain weight. So even if you're eating healthy, but one thing that I always say, don't take your diet to your exercise. What that means, if there's a time in the day that you're going to eat, try to eat before doing the exercise to have energy. Otherwise, you see a lot of people coming miserable to the gym. They don't have energy, so they're going to be much less efficient in doing the physical activity. But it's breaking. It's literally breaking small steps, as you said, small goals, but really need to be specific.
Yeah, I think there's a benefit to eating before and not after exercise too, because especially if you're doing endurance, if you get into a calorie burning state and a fat burning state, if you don't eat immediately after exercise, you continue in that fat burning mode for a longer period of time. Whereas if you go have a big meal right after exercise, you lose some of that benefit. So.
We have there's a lot. We can always cherry pick some studies, but we know if you look to elite athletes, that almost no one in low carb. So carbs are not bad. If you're using carbs and you're doing the exercise, that's super key. You're going to be able to push much more power, have much more quality, do much more reps. And at the end of the day, you're burning much more and you're having much better quality of exercise. So having a good nutrition is essential. It's basically essential.
I really focus on balanced nutrition myself. I'm not trying to be keto. I think the only concern I have with carbs is it's the easiest way to get to too many calories. And so I'm always telling people, keep the carbs balanced, try to have complex carbs if you can, and, I want people to eat diverse and balanced macronutrients. I think a lot of these diets that unbalance them, they may cause you to lose weight, but they're not particularly helpful long-term to your health. So.
And not sustainable. That's the thing. We need to be the same with exercise. They're not sustainable. If you just, or I'm just eating fruits or I'm just eating meat, they're not sustainable. And again, we need to think about evolution. When you say about carbs, they have more calories, easy to overeat. Our brain was never adapted to, in a loaf of bread, to calculate, it's so dense, that's that amount of calories. You don't know that. You're not adapted. We don't have the time to adapt that this is just, and it's really addictive. If you really look to your brain, you're going to understand how difficult it is to say no to that food. That's why we have what we have today, part of the disease obesity globally, because our foods, they are addicted to us. And that's tricky.
Yeah, and I think companies try to make. I grew up eating too much fast food, and I've pretty much cut that out of my life. But I still go by a McDonald's, and I want to stop. I still have that mindset that I want that. And I think I set my mind that way growing up, and I still have that addiction. I just have to overcome it. It's kind of sad that we don't focus more on healthy foods. Yeah,
it's great.
Well, I think recognition is a big part of all lifestyle modification. It's a big part of stress. People don't even recognize they're stressed anymore. I have people I know that I know they're stressed and they don't know it because it's just the baseline for them. It's become the new baseline. And so that's why I think all of these things go together, exercise is reducing your stress dramatically, and they all feed into each other. So it has to be kind of a balanced plan overall.
I don't know how is your experience, but sometimes I see a lot, especially coming from women, the part of strength training. And the first thing they say to me, I don't want to get too strong. And I say to them, believe me, it's extremely difficult to get strong. It's not going to come. You're not going to wake up. Oh my God, it really takes time. So it's important to show them, like,
again, when they do those, when you teach somebody to do a deadlift and they start doing, they become so powerful. It's like, wow, I can really do
Yeah,
this weird thing and I'm feeling so strong. And
yeah.
if they can do a deadlift of 50 kilos, 60 kilos, they can do whatever at home. Home
It's
becomes
funny you
easy.
say that because I started about 5 years ago doing a lot more resistance training, and it's helped me a lot. But I was back in my parents' house in Kentucky, and my mother is 85 and totally healthy. All the women that in my family live forever. But anyway, she was out walking and she didn't like it because it's too humid and hot in Kentucky in the summer. And so I'm like, all right, we're going to the gym. So I took her to the gym. And she was really happy because she realized that her insurance pays for her gym membership when she's over 80 or whatever. So, but she's like, I'm just going to walk on the treadmill. Like, and you show me how to do that. I'm like, okay, that's fine. So I show her how to do that. And I'm doing machine training and resistance training, and she's watching me. And so I said, I'm going to show you how to do one thing. So I showed her how to do pec flies, and she's like, I thought it's not going to go anywhere, but she loves it now. She's like the darling of the fitness center. There's nobody else over 50 there. She's 85. Everybody's showing her how to do training now, and I've got her doing back extensions and ab exercises. And the funny thing about it is she's putting on weight. She's gaining muscle mass even at 85, and that's really confident to her. It gives her confidence, and she calls me and says, I don't know, the pectorals are getting too easy. Should I increase repetitions or wait?
Oh, amazing. And
Yeah,
you're adding her the freedom of having more muscle, more
yeah,
quality, community.
yeah,
She has a
yeah,
purpose. Some days I'm sure she'll like, okay, I need to go to the gym, so she's more happy. So
yes,
that's extremely nice. And actually, the woman that I showed in the last presentation, the last move that has 81, she's my mom. That's
yeah,
why she's really like, because she was always pushing, and it's amazing.
yeah.
It's you see the energy that they have from the community. It's just unbelievable.
So let me ask you a more technical question before we go to the audience questions. You hear a lot about level 2 training now instead of intense level 4 or 5 training. Um, I'm I'm not sure what I believe on that. I do both, but I'm wondering, what do you encourage if you're really trying to improve your fitness? Is level 2 enough, or do you need to be in intense training sometimes as well?
I think it's depends the time you have. So what they call in theory the famous zone 2 training comes from when you
Zone
measure
2,
lactate, and some
yeah,
people say when your lactate is above 2.2 or 2, anyway, it's close to that. If you have a lot of time, like athletes they have, if you have 20, 22 hours a week to train 24 hours, it's very good if you allocate 80% in this time.
yeah,
That's super okay. But if you're a normal, you don't have a lot of time, 5 hours, it's also okay to put, but then you want to start to increase a little more intensity to go to different zones. We can train, I say this a lot to my clients, we can train like athletes because they're the best. The same way we
yeah,
take things from Formula One and put in the cars, why we not copy athletes and put in our own life? We just need to
yeah,
reduce in terms of intensity and adapt. So if you can do zone 2 for 8, 10 hours, do it. But then you also need to add the rest. Like in that study of the twins, the identical twins, you can see if you do a lot of endurance, you have a lot of very good, only kind of slow twitch fibers, but you don't have the fast one. You want to be doing sprint, you want to be doing other kinds of intensity. Zone 2 is extremely
yeah,
good, yes. Should be the only thing you do? I don't think, and I don't see data to see that.
yeah. I started doing a lot more interval training and so running really fast, 3 minutes or 4 minutes, and then a walking break. And I hate it actually, but it improves my function so
But
much.
it should be like that. If you're comfortable, that it never
Yeah,
gets easy. You just get faster. It's never going.
yeah,
You're just going to get faster. But it
yeah,
hurts. It hurts, and should hurt. And actually, there is a study that shows that when you increase your lactate level quite high, actually becomes extremely good for your brain. So there is a study really correlating interval training, high but really high numbers of lactate with brain outcome. So
yeah.
it should hurt.
It's interesting. Let me bring in a Ching Zong here, who's going to bring us some questions from the audience. I'm sure they have a bunch of questions.
Hi, doctor. Thiago. Nice to meet you here. I'm Ting, a PhD student in the CHL. Yeah. So like it's really great talk. I feel most of the people like who relate to that. So we have a lot of questions from the audiences. Yeah. Let me pass to you one by one. So the first one is like one audience asking are the other VO2 max and the WHO physical activity recommendations overrated? Because like a lot of evidences like shows that the muscle mass and strength, the benefits of the muscle mass and strength in preventing conditions like frailty and sarcopenia. So should we shift the focus more towards to the resistance training or the multi-component exercise programs?
Yeah, I think it's correct in a way that depends on what of time you have, and depends the goal you have. For sure, if you focus in strength training, and I did cardio, I love to do endurance, I love exercise, but resistance training can check almost all the boxes. That's correct. It's not going to check the box as good as, for example, VO2 and endurance, but for the rest, glucose control, mental health, muscle quality, muscle function, it's going to click all those boxes. When the World Health Organization 300 minutes of physical activity, it's also include there the strength and resistance training. And it's correct, if you have not a lot of time and if you can do multi-joint movements like deadlift, I squat, that's better. So resistance training is really important, but people are still very afraid of it. And I think it's our fault. I mean, the doctors and health help me, because I don't have a lot of colleagues who say, no, go to the gym and go heavy weights.
Yeah, I agree. It's not just like the single argument between the aerobic and the
No, it's the combination.
It's a combination, yeah. It's not
lifespan and health span. It's a balance of everything. So you need to have this combination with things.
Yeah. Yeah. It's a good question. To the next one. It's a very good question, like coming from two audiences, like because one is asking is an active day able to compensate for the formal exercise, and the other audience was like, oh, it's like they having the from 8 a.m. to 6 p.m. a job, then it's like very hard for them to exercise after the work and the dinner because they have low energy. Yeah, so like how you feel that?
I understand. And again, we need to adapt to every single person. That's why we're talking more now precision medicine, precision general medicine. We need to adapt to each individual. One thing we need to understand, for example, let's take, and I respect, I used to do Pilates or yoga, for example. If you're doing just yoga, you're going to have flexibility, you're going to have good balance, but you're not going to have a ton of power or strength. You're not going to be able to move a lot of weight, especially when you get older. But it's an amazing exercise to combine. So it's important to be mixing those things. But if your work, you're carrying a lot of weight already, you're doing a lot, you think you're checking all the boxes that's necessary for you, maybe that's what you need to do. But what we need to understand is if you're just walking, it's going to give benefits of walking. It's not going to give you benefits of doing other activities. If you just walk, you're not going to be flexible. If you're just walking, you're not to have a lot of power. If you're not sprinting, you're not going to have those things. So we need to try to really, like we do now with like genomics, proteomics, single cell, we need to try to focus and explode a little and understand like, what do I want for me and what I'm doing. If I'm doing the correct thing, that's okay. You cannot run your whole life and hopes when you're 75 to have big quads and be doing like press with super heavy weight. That I think it's you need to target your goal.
Yeah, I think that answers the question. Like, yeah, it's like every exercise got its purpose, like for very particular like component of the body. Yeah. And the next question, do you have any source about like exercise while people undergoing cancer treatment, both chemotherapy or radiotherapy?
Yeah, I think if they have a look in those at least last 2 studies was quite nice to see. And again, if you go back, I'm a lifestyle intervention. That's what I do today. But the majority of the lifestyle intervention, unfortunately, they fail. They're very successful in 3 months, 6 months, but they fail long term. Why? You need to follow up. We need to have an environment that helps you to thrive. And unfortunately, our environment does not help you to thrive. So, for example, if you're having already cancer and having a bad disease, you can do this exercise, but then you go back and none of your friends are doing exercise. None of your friends, you don't have a gym, you don't have anything. It's difficult to keep in the habit. So one thing that we need to try to understand is how we can create a safe environment for us, how my family can support me. And it's never one thing alone. It's going to be all things connected, but we need to be in a safe environment. For the protocols, if you just go back to today's studies, you can see that's not a lot of secret in terms of protocols. It's quite easy. But everything that you can do, it's going to be positive for you if you know your why.
Yeah.
Yeah, I think I just add to that you were mentioning the studies that show that exercise after chemo improves outcomes. I think that there's some research we've been doing here to look at exercise before cancer treatment too. So when you get, for instance, diagnosed with breast cancer, there's often a lag until you have the surgery or the treatment for the breast cancer. So if you can induce an exercise program in that 4 to 6 weeks, I strongly believe that people are going to respond better to the cancer treatment, and that's going to lead to better outcomes too. I agree also that it's about sustainability, but I think there's a potential window of benefit even before the chemo treatment. So.
Absolutely.
So next one is regarding to the exercise prescription given by the doctors. So what are your thoughts on leveraging them in the clinical settings as part of personalized medicine approach? Yeah.
Actually, if you really put in Google exercise prescription, you have a lot of already sources to really do, and you need to choose the protocol that you like. And of course, you can create your own protocol. But it's nice to use something that's already validated but you need to talk with your environment, because if you're the only one in the clinic doing this, again, if your environment's not safe, if you're the only explaining this to the client and they go to the next one, no, the exercise, okay, here, just do this. You need to understand how to do it. So take the exercise prescription, start doing daily, use frequency, intensity, the type of exercise, and write, put in a paper, or nowadays we don't have paper anymore, but so print, I don't know, but give to your client and to a patient an exercise prescription. Prescribe. People are going to think it's weird, but it is a medicine, and sometimes much better than a few medicines that we have.
Yeah, not only do I not have paper anymore, I can't write anymore. I don't know if you've noticed that, but I try to write something, I forget how to write these days. One of the things I think that's helpful also is that, people can start out with some exercise they have more of a comfort zone around, but, encouraging them to get out of the box, push themselves into some other kind of exercise and try to slowly build up that diversity of exercise, I think is really helpful, because I think people tend to gravitate toward what they're comfortable with, and then they get inside one area of training, but not looking broadly enough. So.
But as you said, a lot of people, they want to avoid that pain that you're saying.
Yeah.
And we're not saying that you need to feel pain. And those no pain, no gain, that's a different thing. You need to, but sometimes some exercise, I know I'm going to do now 2 minutes, very intense. It's going to be 2 minutes. It's going to be painful.
Yeah.
If you're taking a lot of weight, you're going to feel. But you should not go after 1 year without not doing anything, go to the gym and get super sore. That's awful. Again, evolution, your brain is going to start I went to that place, I have pain. I don't want to go there. We created this. Probably if I ask anybody, tell me a street that you remember that you have a very good dinner or a very good ice cream. We know those places. We're very good in association. So if you're going to the gym, first few days you have a lot of pain, why you want to go back?
Yeah, I agree.
Right. Yeah, and then next one, like there's a funny fact that we will see some even 80-year-old people looks even more fit than most 20s, 30s every day. And then like, how do you balance your body fat versus the VO2 max?
So the question is how to balance body fat?
Yeah, versus the VO2 max, like the.
So a lot of, they're going to kind of go together. Remember that VO2 max is if you weight less, it's easy to have a better VO2 max. So I think the question, like if you're doing something for endurance to have a better VO2, doing sprints, you're going to increase your VO2 in a way. Body fat is about nutrition. So you need to eat less to enter in a caloric deficit, and then you're going to lose weight, which is going to lose fat, especially if you're doing resistance exercise, which is extremely good in that time, so you don't lose also muscle. So normally, if you're just training, you're going to have an improvement in your VO2, and you're going to have a reduction in your body fat if you're in caloric deficit. You know, a lot of people, I know they can cycle for hours, but if they eat much more than they're burning, they're still going to gain weight. And just to point in one thing, like everything that we're seeing today, it's difficult to change. But if we're starting to change our kids, if they do exercise since they are young, in the adolescence, if they like, if it's in the program, if it's something that's sustainable for them, it's much easier for them to continue to do exercise. So maybe one of the best things we could do for having a health population to save money and to save life is really to teach kids to do it. And then it's going to be much more easy to continue this.
Let me ask you a question I'm sure you get these days. It used to be measuring VO2 max was not something most people did, but now I have this phone and right on the cover of the phone, it tells me my VO2 max. Or not phone, I watch, I mean Garmin. I also have a Whoop that tells me a VO2 max. How accurate are they?
They're getting better and better. So if you see Garmin, sometimes they are close to it. More you are, I think, in the extremities, more difficult it is. But they're never going to. I mean, if you just know a number, it's nice. Oh, my VO2, for example, it's 56. Wow. If you are in the Garmin, you're in the purple zone, so almost nobody. But what that matters for you, when you really do a CPAT with VO2, then you can, if you're doing it in a nice place, they can show you that's your heart rate in different zones. You're burning more fat, you're burning more carbs. That's how I play. But no, those devices are very nice. For example, Whoop, they have a score. But if you see a lot of athletes, they literally block the score. You go to a race, and then you can look to your score. Because a lot of people go, oh my God, I'm red. You need to race anyway. Doesn't matter if you're red, green, yellow. You're going to race.
Yeah.
You need to feel. You need to feel. But those things are getting better and better, and I hope they get even better.
Yeah, I agree. I think they're better. I think we actually have to go now. So I wanted to thank you a lot for doing the show. I think everybody enjoyed it. Thanks, Ching, for the questions. Great job. And I will have you come back again, and we'll see how much all of our audience's VO2 max went up.
Thank you. Thank you, everyone. And yeah, it's try to create a safe environment and understand your why. But thank you. It was really a pleasure to be here. Thank you, everyone. Thank you. Thank you, Brad.
Thanks a lot. So I want to remind everyone to use the panelists and all attendees function to leave comments and feedback on the show. In addition, a couple announcements. We have our Healthy Longevity Talent Incubator going on right now. And there's a Healthy Longevity Talent Incubator Open Day on July 10th. It'll be 9:30 a.m. to 1 p.m. at the LT11 building in NUS. You can email in to get location. You can join us to hear a lot of young people are trying to get into the longevity field, and they're exploring perspectives on aging. And they're sharing key findings from their SG City Missions study to look at perspectives on aging among the Singapore population. So that should be really exciting to hear. Also, we're having a new webinar structure starting in August. You may have noticed some subtle changes and to our webinar and social media posts. We're evolving as we go. One of the things we're going to do is cut from 3 shows down to 2. So we're going to have shows on the first and third Thursday of the month at 7 p.m. We're going to put more oomph into those shows, though. So, and they'll be changing a little bit over time as well. So, keep watching and make sure and register for the webinar to receive the latest schedules. Just a reminder, our schedules for July, the next two shows are unchanged. So, there will be shows on the 10th and 17th. In fact, on the 10th, we have Dr. Luke Aguiar, who's going to be talking about skin and an essential organ for health and longevity. And then finally, I want to wrap up the show by listening to another public person's perspective on aging, if I don't get too tongue-tied. So we're going to hear from Auntie Charlotte in Singapore, who's turning 80 years old, and she's doing 7.5 kilogram weighted pull-ups.
Auntie, you are very fit. I saw you doing weighted pull-up earlier. How are you this year?
79.
You are 79 this year.
Yes.
So you are 80 next year.
End of this year, 80.
End of this year. Wow, you are really an inspiration. Can I ask, like, at what age do you start working out?
At age 72.
Age 72. So you have been working out for
7 years.
7 years.
Yes.
So how has that impacted your life?
I think that it's made me fitter
Made you
than
fitter.
before, yes.
I see.
And then, this is really a young people thing. So in the gym, I meet a lot of young people and engage with them. And I'm so glad to be accepted by them. So basically, they've become my friends. So for my generation, it's not just the people of my generation, my peers, 70s, 60s, 70s, or 80s people. I've got friends here in the gym who are much younger than I am, half my age.
Wow, that's really good to hear. And you are really an inspiration. I mean, in the Singapore scene, I really see people your age working out.
You know, a lot of people use that word, which I don't like. After a while, I don't like it. Because inspiration requires you to act out. Most people say, oh, Auntie, you're such an inspiration. And they just sit back and don't act. They just spectate.
Right. Awesome. I think that's some wise words from you. And also, can I ask, like, what's your nutrition like? I see like you're still very active. Your mental alertness is still very high. Like, how's your diet like, or what is your nutrition?
Oh, my nutrition plan is really up there. Basically, no salt in our food,
Okay.
which is no sugar, no added oil, no additives, and no processed food.
I see.
And then once a week or so, we can eat whatever we like,
Okay.
right? So I've been enjoying this kind of diet for more than 10 years.
I see. What's one advice you give to someone, especially, after the age of 60, 70, looking to get fit? Because I think most people might not have even stepped foot into a gym or exercise before.
Yes, I think that they need to overcome their fear.
Okay.
Whenever you do something new, it's a challenge. So if you can overcome that fear and, like you say, step foot into the gym, that's the beginning of change for you, and you see yourself getting much healthier. And I always tell you, come and join me and be in health.
Okay, awesome. Thank you, Auntie. Thank you.
You're welcome.
I'm feeling like sunshine, like springtime, like something's in the water and I'm taking a deep dive. I'm feeling so weightless, like I'm gonna make it, and nothing in the universe can take this. I can see it clearly now, nothing gonna bring me down.